All right, so thank you for the opportunity to just talk about, my research. And this is highly appreciated. My name is Mamelo Sehwacha, and I'm an associate professor of pharmacology. I started this work back in the years while I was at UCT, University of Cape Town, in collaboration with the University of Namibia. And I continued on the work on traditional medicines and medicinal plants until today. So in fact, this year, 2023, marks 20 years of research in the field of ethnopharmacology across disease areas that include malaria, HIV, and cancer. And I did some research that focused on the evaluation of toxicity of medicinal plants. So today, I decided to share a bit about our research on malaria. And let me acknowledge my collaborators, Professor Kinchembu, who is in University of Namibia, and my student then, who is now an associate professor, Professor Nakwile Paulina Kadila. So I decided to perhaps talk on malaria, which most people will consider as an old topic, old disease, particularly in the face of non-communicable diseases such as cancer, and of course the recent pandemic, COVID-19 pandemic. So diseases like malaria are easily ignored. But unfortunately, the reality is that malaria still remains one of the most significant public health threats. And this is not only in sub-Saharan Africa as we used to know it, but in many parts of the developing world. And this is despite the significant progress that has been made towards reducing this burden in Africa. Quite interestingly, just when we thought that malaria is under control, because we're hearing more about priority diseases like diabetes, like cancer, and viral diseases like COVID-19, just in 2021, the estimated number of malaria deaths stood at 620. And of course, with the African region carrying a disproportionately high share of this burden, up to 96% of these cases happened in malaria. South Africa, in particular, in the last 2 years, we have seen up to 30,000 records of malaria in the country. So malaria is not completely gone. It still calls for researchers to put down efforts to try to eradicate malaria. In fact, South Africa is aiming to eradicate malaria completely in 2023. And quite interestingly, there has been a slow development of malaria vaccine. It has been decades now. We're talking, research that has been done over 2 or 3 decades. But to date, there are only still a dozen of malaria vaccines in clinical trials. Yet when you look at COVID-19, there are about 170 vaccines or vaccine candidates that are in clinical trial. So really 12 against 170, it really shows the slow, or rather, not so much effort being geared towards, malaria. One is not sure whether this is perhaps a disease that's an endemic in Africa, but one of my interests when I saw the seminar, and of course coming on board, was to see the research that has been talked about by the South African or the African researchers, and to really try assess whether African researchers are focusing on diseases that are of priority to the African continent, or we are simply as Africans being guided and therefore being controlled by the availability of funding. So having I think, provided that overall background, we have looked over the years, at or into medicinal plants in general, and these are medicinal plants that are of South African origin or that are found in South Africa, and of course, and also the medicinal plants that are in Namibia. And in one part of our research, we specifically looked at the indigenous mushrooms that treat symptoms similar to those caused by malaria. And we conducted an ethnobotanical survey of putative anti-malarial mushrooms that are used in Namibia. This was done, with the local people who were the ones that guided us through into the communities, into the forests, that helped us with the identification, but also entry into the communities, identification of these mushrooms, and of course some backgrounds on what the mushrooms are used for. We went, and this is my collaborators when I meant we, I was not in Namibia for the collection, but my collaborators went as far as, the northern part of Namibia, the northern central part of Namibia, the Kavango East, the Kavango West, and collecting these mushrooms based on indigenous knowledge and the historical use of these mushrooms. As you pointed out quite rightfully in the beginning, that mushrooms have gained interest lately. And although we know that they represent the world's greatest untapped resource of nutrition, mushrooms are high in protein, and so they are quite valuable as nutritious food. But mushrooms also have significant medicinal importance. There are about 12,000 species in the ecosystem that really serve as potential source for producing pharmaceuticals and nutraceutical compounds. And of course, the discovery of penicillin from fungi is a good example. But although the indigenous mushrooms are putatively used to treat malaria in Namibia, we found that there has really not been any empirical studies to investigate their anti-plasmodial activities. And of course, their toxicity, which is more important to the community to share education on the safety or toxicity of these plants that are consumed by the communities. So we looked at Namibian species that included the Ganoderma species. We looked at the indigenous truffles, a number of them which have been reported to have pharmacological effects. We know mushrooms have many reports, including immunomodulation. We concentrated on that, anti-inflammatory, antioxidants. They're also seen to be chemopreventive. They have anti-tumor, antibacterial, antiviral, and many other pharmacological properties. We looked at specifically those that have been reported to improve the quality of life for patients living with HIV, for example, because then we knew that they could have immunomodulating properties, which for malaria, again, is quite useful, as we know symptoms of malaria include cold and fever and so on. So having strong immune system is quite helpful, in fact, improve the quality of life of malaria patients. The Ganoderma species in particular is quite popular, not only in the world, but also in Namibia for its immune boosting and HIV or anti-HIV properties. So then we concentrated on such. But again, our research was also based on the reports in the literature of several mushroom species that have been reported to have anti-malarial activity. And these were mushrooms that actually showed activity on the Plasmodium falciparum parasite, which for Africa, I think is the most problematic one, which accounts for most illnesses due to cerebral malaria in Africa, and which is the lethal part or the lethal type of malaria, which is the real problem on the African continent. So we then concentrated on Plasmodium falciparum. So we have several mushroom species such as the polyporus, which have been reported to have 100% effectiveness against Plasmodium falciparum. We relied on several reports like the Planteus species, the Cordyceps species, which have also been reported to have anti-malarial activity. But on the work that has been done or was done specifically by my collaborators in Namibia, was the work done on the aqueous extract of the Namibian indigenous species that included the Tapesia filialis species. The previous reports on this species, reported quite incredible anti-Plasmodium activity, specifically against the resistant strains of the Plasmodium parasite, which is quite problematic, as we know that our current anti-Plasmodium activity conventional drugs like your chloroquine, several quinines, and the SPEs, these parasites have really gained resistance against such drugs. So in fact, resistance is one of our key challenges in combating malaria completely. So we relied on this literature that showed that, in fact, mushrooms could be useful in the treatment of malaria. And so we collected some few species that you see there. And just without going into the actual scientific results, because I think those are not so important, just to highlight that from our research, it was quite interesting to see that some mushrooms, and I picked specifically two mushroom species, really showed the highest antiplasmodial activity. And this is in the range of, nanograms per ml. So if you're a scientist, you would know that the nanograms per ml is quite comparable to the standard drugs. So it was quite interesting, in fact, to find that activity. So generally, and this is in conclusion, in the study of the 4 mushroom species, and now the 4 being the Gonodema, the Termitosides species, the Kalahari Feli species, some of the species really did not show that inhibition, a direct inhibition to the parasites. We saw about 40% inhibition, which is not really great when you're looking for a compound that can be further developed into a pharmaceutical entity, or rather a pharmaceutical candidate. But some, as I've pointed out, showed really good direct activity against the parasites. What was clear and was interesting in the research was that we used, for example, the organic solvents to do the extractions, and that's what we mostly use in our laboratories. But what we found that in the previous research, researchers used water extracts as opposed to organic extracts, and that really speaks to the way we do research in our own laboratories, the methods we use for to go about our research, and whether that simulates what really happens in the real life, and that determines the usefulness and the meaningness of our results that we obtain from the laboratory. So for us, this was most I think helpful to see that, in fact, the water extracts, which could mean the natural way on how these traditional medicines or these indigenous mushrooms are being taken in, is in fact more useful than the methodologies of extractions that we may use in our own laboratories. So David and my colleagues, I think generally, to conclude on the significance of the research that we have done over the years, not only looking at the mushrooms, but of course including the work we've done on mushrooms, and what this work means generally to scientists, but also to the communities that use these medicines. I talk now on traditional medicines, I talk also on medicinal plants, and what really one could consider as significant outputs or outcomes. And again, the significant outcomes would include, I think, providing activity or information on the activity of these medicinal plants, particularly against parasites, parasite strains that are resistant to conventional drugs, as I've mentioned. We know that resistance in the African region is as high as 60%. And back then, artemisinin combination therapy was the most effective therapy. But there's been recent, reports on the parasites having acquired resistance to artemisinin combination therapy. That simply means to us that we are in trouble. So it is important to find alternatives that can really help combat resistance. And of course, again, particularly now related to the field of ethnopharmacology, the identification of the heat compounds as potential anti-malarials was also important. A number of compounds have been identified chemically, but although some of them were known molecules which could not be published as novel, but known molecules were identified. So people know now, as they take these medicinal plants, they know what compounds are in there. It helps with standardization, but it helps with Again, talking to the doses that are recommended for patients in taking these traditional medicines. If I can give example, one of the plants we worked on, which was quite toxic. And that word went out into the community to say, hey, in using this particular medicinal plants, please be aware that this plant is quite toxic. So rather evaluate your dosages and make necessary changes here and there where possible. And again, just thirdly, the usefulness of the research was in using various animal models, which helped us determine which natural products or which medicinal plants have prophylactic activity or prophylactic properties, which then can be used for preventive purposes, and which ones really have curative properties. Was actually interesting in one of the plants we worked with to discover like a plant that we use, in fact, sometimes is used as spice, the buchu plant, Betulina, I've forgotten the last species name, proved to have very strong prophylactic activity against malaria. So again, information like that going out into the community, quite helpful. And the last significant output that came out of all this research is the toxicity studies that in one helped educate the community, but in the other also helped channel some of these toxic compounds that were discovered during this research towards cancer research. I can give from our own work examples of compounds like xerantholide, which we isolated from Petulina betulina. This was the first elucidation of this compound as an active antiplasmodium agent from an indigenous Namibian plant. But we found that we were quite discouraged in developing it further as an antiplasmodium agent because of its high toxicity level. But what helped us then was to channel this particular agent towards cancer research. And there are many more that we have channeled towards cancer research, only to find that this compound is already in the phase 1 clinical trials and entering phase 2A clinical trials towards cancer. So generally and in general, I would say that's the work that we have done in the disease area, malaria, and that wraps up the significance of the work on mushrooms, but also on other medicinal plants. And with that said, I would like to thank you for your attention.
Thank you very much, Mamelo. So this is quite intriguing because we generally just want to eat mushrooms. So I think there's a whole world out there of indigenous African mushrooms and also how they are used in traditional medicine. I don't think it's that well documented. So this is really quite good. I will ask the audience if there are any questions or comments at this stage. Okay, so no questions. Yeah, there's a baby in the house. So there's like, not mine. Yeah, but thank you very much, Mamelo. We will now go over to...
It was a pleasure. Thank you.
Yeah, all right. Professor Robert Nash, over to you.